Welcome to the Mom as Well podcast, where we are digging deep into the gifts and the gaps of foster and adoptive parenting. I'm Tara Hutton, and I'm glad you're here. Mama's Well. Yes, she is. Hi, guys. I am glad to be back. I hope you're having a great week. There is always a lot going on this time of year. And so just trying to manage that and stay in check myself is, I think, at the top of my priority list right now. So I hope you are taking good care of yourself. I hope that you are able to take deep breaths and just remember that, you know what, the most important thing, right, is that we just stay in connection with our families, that we stay in connection with ourselves, and that we are, as they always say, remembering the reason for the season. So anyway, I'm glad you're here. I have a guest with me today that I've been really excited to talk to. She is a licensed professional counselor. She is trained in a I guess methodology that I have had experience with myself that is very fascinating to me and incredibly helpful to me, and that's EMDR. And I'm going to have her tell us a little bit about that. But she is also a play therapist, and she works primarily with our population of children. So children that have experienced traumatic first few years, months of life, and are in, a lot of them have been in foster care or have been adopted. And so that makes her especially knowledgeable about the behaviors and the things that we're dealing with. And so I am super excited to welcome Stephanie Walsh.
Well, thank you, Tara.
Good morning.
Good morning.
Thank you for being here so early on a Friday morning.
Glad to be here.
Yeah, thank you. Stephanie, you use play therapy,
yes,
and EMDR, which we're going to talk about a little bit about that. But before we get started in that, like, you're seeing the kiddos that we have in our homes. Yes. I thought today I'd like to just talk about some of the problematic behaviors, because, you know, we're moving into the holiday season, and during that time, like, our kids are going to be out of school.
Right.
B, there's a lot of added stress.
Correct.
That's going on. I know for me, you know, we host a lot of the events. My parents have passed away, and Kyle's parents are getting older, so we're hosting a lot. So there's this, you know, and you know, I like my house to look nice, right. And I like the food to be good. And so there's this current of undercurrent, even though I say I don't want it to get to me, it can.
Yeah, absolutely.
And so, and I know for me, when there's that in my life, like, it can add a lot of pressure.
The kids know. Know. They see it. They feel it. They don't even have to see it to feel it.
Yeah. So what are some, so we know that's going on, but then there's just behaviors that are happening all the time, because we're trying we've brought kids in that they're on alert, and they're anxious, and they're fearful. And so there's always this showing up. What kind of behaviors do you see? Like, when someone says, I don't know what to do, I've got to find a therapist, and they find you, what are some of those behaviors that you see?
Typically angry and rage and lots of anxiety of unknown behavior. And that's what they're exhibiting at home, and it's over the top. It's too much. And so they call, and so, you know, I want them to have some practical things in their home that they can apply and use that will help them. But sometimes it's so much they need extra help.
Yeah.
You know, like myself.
Yeah. Yeah. So let's talk about rage. Because I know when I spoke to you prior to this, you said that's one of the biggest issues that you see in your children.
And the people that call me, those children, they're raging, they're angry at, it could be the littlest thing. and that comes out. And it can be a trigger. It can be, which we know anger is a secondary emotion. And so they're either sad about something or scared about something, and it's exhibited in rage. Okay. And, we don't want kids beating up on other kids or hurting themselves or other things. And so, but we can't just say, no, don't be angry or don't be upset and rage. What's an appropriate way? What's an acceptable way to be angry or to rage? What can they punch? Can I punch a pillow, my bed? I've had kids take plastic bats to big old trees, that we're not hurting the trees. And it just kind of gives them a little relief. And I'm not saying, okay, they get to do that the rest of their life. But while it's being processed or fixed, so to speak, a way to get that out for a short period of time.
You brought up something that I think is so important in my life as a child. My dad was removed. I was removed from my dad. He's had an addiction issue, and I had a lot of rage. My mom called it temper tantrums, and she said I would get so upset that I would literally bite myself. And they just called it temper tantrum. So I just kind of got labeled a temper tantrum, I just throw fits is what it was called, and, but in looking back, I can see that I was grieving and that's a stage of grief is anger.
Right.
And, it wasn't allowed. My mom was very uncomfortable with that. And I am honestly, if I'm being perfectly honest, rage is something that scares me and I'm uncomfortable with.
Right. We don't want kids hurting themselves or other people or things. And so like I said, is what is appropriate, what is acceptable when angry. I highly recommend some kind of maybe an organized martial arts or something, where they're getting structure, but they get to be aggressive in an appropriate way, if they're the right age. But you're right. Let's show them appropriate. They have to be able to exhibit it and get it out.
But here's an example. This just happened last night. It just popped into my head, but the girls were coloring at the counter. They were working on some schoolwork at the counter, and it required markers, different colored markers. And one daughter took a marker from the other daughter's box without asking, and the one whose box it was got very angry, very fast, and shoved her plate and her box away and just left the room. And I was mindful last night. In the past, my instinct is to say, that's not nice. What are you doing? She just needed to, in kind of a defensive thing.
Sure.
And last night I didn't. I just let her go.
Yeah.
And it was the funniest thing. And I talked to my other daughter and I said, well, what could we do differently there?
Sure.
And she said, I could ask. So I just spent my time there.
Yeah.
And I said, well, sometimes we forget to ask. Maybe you could do that next time. And then the other daughter ends up coming back in, and it was almost like it hadn't even happened.
And if you had chased her down, it might have made it worse.
Yes. It would have made it worse. And the funny thing was I could tell that she had kind of calmed down. She was almost on a totally different, it's like she went out of her brain.
Yeah.
And then she was fine. And then I was able to say, what did I say? I said, I'm glad you're back. And I think I said, I talked to Skyla about asking next time.
That's great.
And then I might have brought up something, how she might have said something. I can't remember. But I thought victory, because it was only about a 5-minute crisis.
Right. And the key there was you gave her space. And I think that is huge for parents, to give their kids space to feel. It all has to be, appropriate and acceptable. Give them space to feel, and that just helps them kind of come down. And then you get to decide, okay, what part of that do we need to address?
Yeah. I mean, she just got angry.
Right.
Yeah.
Yeah. Right.
So allowing our kids to feel. Is there something, obviously you probably are seeing kids that are acting out. Obviously she wasn't trying to harm anybody.
Right.
So what do you do in a situation when you have a child that's trying to, that's literally can hurt themselves or a sibling? How do we handle that?
Well, if the behavior is so intense that themselves, they're either harming themselves or others, then you need to bring in a professional, of some sort, really, to kind of help that. If saying what you're allowed to hurt is this pillow, or if that's not working, the appropriate way to get out your anger is not working, then yes, you kind of need a professional for those skills, and like your daughter did, just getting away. That was brilliant on her part. Get away from what's making you angry. I tell the kids that all the time. That
get away
helps their brain.
Teaching that in non-conflict, I'm sure, right? Like, okay, when I'm angry, and sometimes I do it for myself. If I start to feel angry, I'll say out loud, I'm going to step back a minute and take some breaths because I'm starting to feel angry.
Absolutely. And us modeling that for those kiddos is big.
Yeah.
For sure.
I want to talk about more behaviors, because I think like sometimes we're just like, oh my goodness, like, what do I do with this? What do I do with this? What do I do with this? But you said a word while they're processing it. I think that's what you said. So that kind of leans me to like want to talk about the therapy that you do, because that's essentially therapy is helping us, giving us space.
Right.
Is that right?
Right.
To process.
Correct. Whenever you bring them into therapy.
Yeah.
And, when I say process, there's multiple ways to process. At home, if they're coloring or they get to say, you know what, I remember something about my past. That's also processing, it doesn't have to be in an office setting.
Okay.
But in my office, yes, there's lots of toys and rice trays and figurines and art and puppets. And so lots of modalities that kids can relate to, because you don't typically have to teach a kid how to play. That's just their language.
Isn't that great?
Yeah.
We forget that. I forget how to play. I'm not a great player anymore.
Oh, come on in. We just get you back.
Yeah.
So you don't have to teach them how to play. And a lot of times, even older kids who have experienced trauma emotionally, they are much younger, and so they just fall right into the play. But also, like you said, I use the EMDR processing, and what that does is their brain is holding on to a trauma, a memory, or multiple, and there's emotions, big emotions that are tied to that memory and that trauma. And so what EMDR does is it allows that all the emotions tied to that trauma, that event, to just lessen and lessen. And kids process so fast because they don't have extra stuff to add to it and hold it on and justify.
Yeah.
And so they think they're just playing. And while we are doing EMDR and processing, you get real creative.
I know what EMDR looks like because I've experienced it. So, and I'm sure with adults, it's different than with kids. So I'm just tell how I processed it, and then you tell me how that works with kids. But actually, I'm going to try to say what I think it is.
Good. This will be fun.
And you tell me. So, in my therapist's office, we held little like vibrating.
I call them tappers.
Yeah. And then she also had a screen, which sometimes we used a screen and sometimes we didn't, that had little red dots, electronic dots that went across the screen and then back, across the screen and back. And so when I was holding these tappers, they were buzzing. Zzz, 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 zzz,
almost tickly. It's
alternating.
Not like electrocuting.
Yeah, no. I just felt like I could just feel like I was holding a toy maybe that was vibrating.
Yes.
And then she was asking me about certain things, and then she would say, how do you feel? Or
what do you notice?
What do you notice? Yeah. And then she would say, I would tell her, I feel sad, or I feel frustrated or I feel scared or whatever. And she'd say, notice that. And that's really all she did. And it was a while before I realized, and I would close my eyes. I prefer to use the tappers and not use that screen. Right. But I noticed that my eyes were moving. They were following the tappers.
Oh, funny.
Is that not what is supposed to happen?
It can. It doesn't have to.
Okay. I felt like that was starting to happen. Maybe it was just because it was such a rhythmic motion back and forth. But anyway, I can't imagine how that works with children. So how in the world, and by the way, it was incredibly profound what showed up for me. She was awesome. Processing things that were when I was born and even before. Right. I don't even understand it, but it was fascinating. Clearly something there because of my response and the way I felt. But how do you do this with children? And then what is the research behind the effectiveness of something like this?
It's so effective. The youngest I've used this with is a 3-year-old, and you get real creative because they're all over the place when they're playing. So, the tappers, and I call them my magic buzzies or my magic tappers, and I'll just introduce them and just say, hey, hold on to these for a second and just feel what they're like, and they're like giggling, and drop them and move on. Okay. And I'll just real easily explain to them, the magic buzzies will help all those icky feelings, like whenever you feel scared or whatever, make those go away. Yeah. And I'll put them in their shoes when they're moving around the room, or I've draped them on their shoulders or put them in pockets. I've also with kids where you can just tap their hands, like they'll put their hands out and I'm tapping their hands, or I'm tapping their shoulders. Okay. That, very effective also.
So what's happening when we're going from, I know it's this, it's got to be something with the hemispheres of our brain or something. I don't know.
Right. We have a right and left side of our brain, obviously. And so what those back and forth motion is doing is getting your brain to go back and forth and connect across that amygdala there in the middle that houses our turned on, my emotions. I've got a lot of negative emotions right now. As it goes, it makes the brain go back and forth like that. It calms down that amygdala that turns on, and then therefore all the emotions, the negative emotions, fade away. You don't forget that event happened, but when you remember it, there's just no more disturbance with it.
So incredible.
It really is, and you can see it in kids fast. And so if it's so we either do it in first or third person. Okay. With really anybody, if you can tell they're really feeling this, we're going to get out Mr. Puppy and we co-create this story. Okay. Find the mean puppy that you think would work in here, and they do it. And then there's feeling cards. So they're very involved. And I've even had parents who will be in there tapping the shoulders while we do this, co-create the story, which also can go to fixing that attachment.
Do you work a lot with parents and the child at the same time?
Maybe 50-50, I would say. Kind of depends on the situation, their relationship, and where the kid is. Especially the younger kids, I'll have them because I've got to be doing a lot of stuff up front with the EMDR while the mom or dad's tapping. Yeah. So very effective. And recently I've had a little bit older kiddo who actually went from that third person, brought himself into the first person, and was like doing what they needed in the rice tray to finish this process and feel so much better about this. And it was just really fascinating.
That was interesting. I was processing when I did mine. It was in the third person. I said the baby. I was, and later, a few minutes down the road, she said, "Can you see the baby was you?" Or something like that. And she had me connect back. Gotcha. That baby was me. Yeah. I mean, I knew the baby was me, but I was speaking it out as if it weren't. I think that's interesting.
Yeah, somewhat removed, but yeah. That's the thing, womb trauma can happen in the womb. Yeah. And so how do you process that?
Yeah, no verbal. These kids don't have the verbal skills a lot of times to tell us what happened.
Exactly.
What happened to them? They don't know.
And so many, foster adoptive families, they've got them from babies,
Sure.
and so they're not going to have cognitive awareness of what happened. So what I have parents do is compile some baby pictures and some mommy in the hospital pictures of the adoptive family getting them, and we write a story together, the parents and I typically write the story, and it's third person telling some of the trauma, but not in an age appropriate way. And then what it does is it takes through, and then now look at this baby and how healthy this baby is. And now this baby is 6 and in a loving family, and during it, you get to say, how do you think that baby was feeling in that mommy's tummy? Because the mommy was, I don't know, not making good choices or drinking too much Coke. And then they just get to go, feel for that baby a little bit. And we process that. And it's just fascinating.
So when they are saying, I feel this, is that when you're tapping?
Yes. Whenever I say, okay, what does that feel like for that baby or little puppy that's so just, in the rice tray doing something. How do you think that puppy feels? Oh, he feels sad. Or he's scared. Oh, let's notice how that puppy feels.
I love the third person thing. It's really cool.
You
because
don't want to re-traumatize.
That's really good. What you just said. I learned this from Dr. Cohen. He has a book called Playful Parenting or something like that. And then also Adele Faber, years ago, I read How to Talk So Kids Will Listen, and they talk about inanimate objects play. Like in other words, and just a couple of days ago, they were fighting. We saw the birds, the robins were taking a bath in our waterfall. This was just Friday, a week ago, or Monday, and the girls were like, my daughter Skyla, look, the birds are taking a bath. And so we watched them for a little while. Then all of a sudden, for some reason, somebody had to decide that they were the ones who saw the bird first.
Of course.
We were having such a nice time. And then somebody had to see the bird first.
Right.
And then the other, no, you didn't see the bird. No. And I was just like, I wanted to, for whatever reason, I had the wherewithal. I picked up my coffee and my cell phone and I started talking. No, I drank the coffee first. No, I drank the coffee first. You can't drink the coffee. You are the coffee. And we just went, and they literally just flipped from that to laughing at me.
And you know what? You were able to do that because you were in a good place yourself.
Thank you.
Having good self-care is crucial for parents.
I was that day because they were both homesick that day. I don't know why I was in a good place, but I was. Because the other time I'd be like, stop arguing about what difference does
yelling.
It make? Yeah.
Oh, wait. I'm yelling.
Yeah, I like that third person thing. I think that's a tool that we can grab a hold of.
Yes, absolutely. Puppets doesn't have to be puppets. It can be anything. If you've got a coffee cup and a cell phone.
A coffee cup and a cell phone.
Yep.
That's all I had.
Absolutely.
Isn't that
was
funny?
Good. That's funny.
It worked.
It did work.
But I had never thought what I was doing. I'm showing them themselves without pointing it out.
Yes. Right.
And they saw how ridiculous it was.
They would have been offended. Mom,
yeah. And it wasn't effective because they would have just kept having to defend themselves.
Correct.
Instead of of course, a coffee cup and a cell phone. Anyway, that's all I have. Okay, so EMDR is a modality that where did this come from, and what's the research behind it?
So 30 plus years now, the creator noticed that she was walking in a park and she felt, a little bit of disturbance, like she was trying to figure something out, I believe. And when she got to the end of the path, she noticed that she felt so much better. And so she went back and retraced her steps, and she noticed when she was walking down the path and thinking about this thing, she was looking from side to side.
Interesting.
And just her eyes moving, and that's just kind of where it all blossomed out of, because it stands for eye movement, desensitization and reprocessing.
Yeah.
But so the eye movement, which gets your brain going back and forth, but it can really be like the tappers or the tapping, and
What is, and I've used this, but I don't know if I'm using it correctly, a butterfly
Yes, butterfly hugs.
hugs. Yeah. Can you tell us about that? Because that's something
Sure.
we can do at home, right? Now, you're not watching. I'm crisscrossing my arms across my left arm's touching my right shoulder.
Yeah.
My right arm's touching, my right hand is touching my,
Yes.
like
Hands
like
on
a
opposite
butterfly.
shoulders. Yes. And then you alternate back and forth. And it's very slow and very calm, and really want to do this when kids are not worked up.
Okay.
I can't recommend people who aren't trained in EMDR to process stuff at home with EMDR.
Yeah.
But yeah, the butterfly hugs can be, let's just breathe, let's let's think about things that make us calm and go from there. Because that is the very, very first step of EMDR for kids or adults, and coming up with a safe, calm place. Where do you feel no disturbance, very safe and very calm, and on a very slow tapping, we just and it just makes it so deep. And so for the kids, I will start puppy in the rice tray and say, what does puppy need to feel safe?
This is how you're helping them find their safe place.
Yes, I want them to know puppy is never alone in this scary rice tray with what's about to happen.
Okay.
He needs friends. Absolutely, let's pick him out. Who are his friends?
Yeah.
And then I even have this magic fairy guardian, whatever, that, and I just introduce her. She's always here with us, and she gets to help us. Is there anybody that you think of in your life that helps you feel brave or... Okay, and then that can, we'll act like that's that person. And if things get intense in the tray, she can swoop in and just she's here for us, give us what we need, just want to not re-traumatize anybody.
So what does the butterfly, because I guess my therapist told me this is something I could use with Trini when she's calm, or my daughters, but what am I doing? Because I haven't ever done it because I don't really know what I'm doing.
Well, and it's just slow because because the tappers are really fast and the eye movement's really fast. When you're processing disturbing stuff, it's fast.
Okay.
The butterfly hugs are very slow, and when you're doing the safe, calm place, the tappers are very slow. The speed, what that is doing is still getting your brain to go back and forth, but it is just the tempo that makes it sink in as a safe, calm thing. And that's what the butterfly hugs are doing. And
so I would maybe do this after we've not processed a trauma necessarily, but after we've maybe we've come to, like, maybe when she entered the room yesterday after the upset with that. I mean, I don't even know if she would have done it. Sometimes I think I just need to step back.
Right. You kind of read the room and for sure, just not, you can't do it wrong if they're calm.
Okay.
Just don't butterfly hug when they're raging.
Maybe I should just do it myself and see how it works.
Absolutely. Yes. I mean, and back, to how powerful EMDR is. I have used it a couple of different times on my own kids, just, little things that have come up. I've used it on myself before whenever something's happened to my kid. One time she fell and knocked all 4 of her front teeth out. And just that initial image of all the blood, I couldn't get that image out of my head for days, after we rushed her to the dentist, blah, blah, blah. I just kept, I closed my eyes and there it is, and I just felt it. So I actually did like fast butterfly hugs, and I was just, thinking about it, and it just...
That's amazing.
Yeah.
Oh, I am
flutters
a
away.
big fan of this. And it's hard. It's hard to find therapists that take our Medicaid that also use EMDR. So I'm very grateful because you do.
I do,
some of the Medicaid.
For sure, for the foster care kiddos that have their own insurance. I also struggle to find a therapist who does EMDR under the age of 16, 11, period, in the area. And I'm always searching, but...
Because you're doing it, you combine play, therapy, and EMDR.
Yeah, and you have to.
Yeah.
Because they're just not gonna...
Because there's not a narrative to tell you about.
Right.
Like for me, I had a narrative, some of it. Some of it I didn't. Some of it my therapist said, let's talk about.
You had blocked out stuff too, so yeah. I mean, above the age 6, that's when things start getting cognitive, like, oh, this is happening and this is not okay. This shouldn't be happening. Below that age, you're not really cognitive. That's why a 3-year-old might have been perpetrated by an uncle or something and still go sit in his lap. You know what I mean? But it is internalized. You see it in their emotions and their behavior. That's why you see regression in behavior, baby talk, bedwetting, that kind of stuff.
One thing I'm noticing, Stephanie, is that in our home, I'm starting to become more and more aware. I said this a couple weeks ago on the podcast, but it's been 7 years for us, and I feel like I'm just now. The smoke is starting to part, and I mean, not that I haven't had these clear moments before, but I feel like maybe finally I'm starting to have more and more, and my clear moments are coming closer and closer together.
Sure.
And one of the things and I mentioned to you before we started recording this, is that I am practicing being more of an observer of my child versus like I'm, as you can tell, if you've been listening to me for any length of time, like I want to fix something.
Right.
I want to get this fixed. I want to take care of this.
Right.
I want to fix myself. I want to fix my poor old husband. And of course, if there's something that I perceive is going on with my child, I want to fix it.
We want them happy.
Yeah,
and
that's
safe.
not being hard on myself. It's there's a lot of reasons. Some of them are healthy and some of them aren't. But I am kind of taking a stance now, and I want you to speak to this, of sitting back and noticing, as you say in EMDR, notice that, noticing things and trusting that my child is processing through them, and that I can be kind of like a bystander in a way.
Right.
A very caring, nurturing, calm.
Right. It's not like you're checking out.
No.
Like, okay, they're going to deal with that.
Yeah. Tell me about that, because the behaviors, processing something can look like a bad behavior, can't it? Or not necessarily.
Trying
to process, like great grief or anger or rage.
You're saying the kid
sadness.
is exhibiting bad behavior
What
at
looks
home.
like bad behaviors to us, it could simply be their efforts,
They're gonna
maybe
work through
futile
something.
efforts, to try to process through something.
Sure. Absolutely.
Like,
yeah.
Help me understand, like, am I know I am. I'm trusting myself that I am onto something in this observer role. But more so, like, what does that look like as a parent?
Whenever they, whatever's going on throughout your day, and if they are just to mention something from their past that they remember, that was somewhat traumatic, maybe not necessarily to you, it doesn't sound like, but it was to them. Yes, let them just talk, and I wouldn't give them 1,000 questions. Maybe just, what was that like for you? Or if they're showing an emotion, say, wow, that really looks like that made you angry. And seeing where they go with it, and go with them. Let them lead it and guide it. It's like play therapy. It's child-centered. I direct nothing unless it's our creative story play. But I'm letting them lead the play. And so you're letting them lead that through that memory that they are verbalizing. And when it stops, if they move on to talk about something else, let them move on. Yeah. If it is a tantrum, like, we were saying earlier, they're raging, they can't just go hit everybody in the house.
Sure.
So, okay, what's appropriate? And when they're raging is not the time to discuss it. So maybe it looks like holding them. Maybe it looks like kind of herding them away from hurting something, themselves or others, and giving them this space to just, be angry. Yeah. And then, if they'll let you hold them. If that's safe for them, if that feels safe for them. And you're just giving place for their, what's the word I'm looking for? Whatever emotion they're expressing. Yeah. And again, it has to it has to still be appropriate.
Yeah.
And I think our expectations of these kiddos need to be somewhat different than older kids or maybe biological kids, because we're expecting, they're coming from so much hurt and pain that they're not immediately going to be able to, it's going to take them a while to be able to take care of their room pristinely and do all their laundry from start to finish and, do all the list of chores. So have fewer expectations, but also takes care of you as the parent. If you lower that and all that's expected is that they're kind or not mean, you know what I mean?
Yeah.
And then over the years you get to expect more.
Yeah.
Yeah.
I think, I hear you. I hear like lowering our expectations, realizing that these behaviors, particularly the rage, which is the one you said you see so much. And I understand that. I see that. And by the way, my daughter will not let me hold her when she's angry.
Right.
Like
some of them it's
that I've tried that. It perpetuates it. And I'm still trying to figure out what to do. I think I need to just sit down on the floor right where she's at or something. I don't really know.
On her level. And, I'm not a fan of giving tantrums an audience because sometimes that kind of fuels the fire. You kind of got to know the child, but you're right. Maybe it's sitting off to the side and your attention's focused a little elsewhere and they're right there because really you want to stay nearby to make sure they're staying safe. Yeah. So that's excellent that she's not a holder.
I haven't mastered that yet. But that's just it's what my gut says. Sit down. Yeah. Just sit down on the floor and just wait it out.
I'm here for you. Yeah. What does that tell that kid? I'm here for you. I'm not towering over you. I'm not trying to restrain you,
Yeah.
And I'm not leaving because, a lot of these kiddos have just been left
right. And that's
so
my
much.
instinct is to want to, fine, okay, when you're done with this, because it's just like,
it's disturbing, and I don't want to watch it.
Right.
Yeah.
Let me ask you about something else that happened. As it would, right before you get here, I'm utilizing this thought process. But I think I had a clarity moment recently. One of my daughters, the younger one, she has an attachment to this little froggy blanket that my son, who's 18 now, had. And so when she came to us, I put a couple of these little loveys in her bed. Well, she chose the exact same one that my son had his name monogrammed. Well, about a year ago, she left it at a cross-country meet. And so we found another one, same material, same brand, little bit different, but she has another one. And then since then, we've even had another. So she's got these 3 little stuffed animal frogs. Every once in a while, she will, not even every once, once a week, maybe she'll make it 2 weeks without this happening, but she will just melt down crying about how she misses that original frog. And it's, at first you're like, you kind of comfort it, but it was getting so big and so often and would go on for so long that it was starting to be like, an eye roll. We were seeing, like, my husband and I would be like, oh, here it goes again. Well, the other day, I don't know why, it just hit me like, if this might be real. This might be grief. This might be an opportunity. And so I picked her up and I was holding her and I said, you are really sad that you lost Froggy blanket. And that's called grief. I just gave a word. I was just like, this is grief, because I've grieved both my parents and many things. Right. And I said, and part of grief is when we feel really, really, really sad. And that's all I said.
Wow.
And she hasn't done it since. Now, I don't know, but I just thought, what a great, in my mind, I'm just looking for an opportunity, because she'd had a deep loss and she was very little. And so she doesn't necessarily, experience it in the same way that my other daughter does because she was older.
Right.
But that kind of, talking to you and thinking about this, like, I might have just helped her process.
And you validated
Her, I mean, yeah, I've never invalidated, but it was like, oh my
Right.
gosh, this again.
Identified too.
Yeah,
Give a name
it just
to.
seems weird that she keeps bringing up that same exact froggy when we have these other
Sure.
ones now, and she
Sure.
likes them clearly as much. I mean, could that be what had happened?
Absolutely. And it could also signify something else she's,
Grieving.
felt like inside her soul she's lost.
Yeah.
But doesn't know cognitively.
Yeah. Well, I was thinking her mother.
Yeah.
Right.
Right.
Anyway, that's another observant thing.
And write that down. So whenever you're having a hard day, you go back to that and just encourage yourself.
Yeah, I think it's new eyes to see what might be happening in these
Yes.
situations, and then yeah.
That's so good.
Okay, so what are some other? So grief is obviously a big one, which is you mentioned the secondary emotion is anger of sadness, which would also be grief, right?
Right.
So sadness, and what was the other? You said
Well,
underneath anger is
sadness
or-
and wow, hold on.
fear.
Yes, I'm scared of something.
Yeah.
Yes.
Okay. So then what are some other things that show up for you in your office? Like, okay, like I don't know how to deal with this anymore. Help me. What are those behaviors?
So anxious behaviors
Okay.
for kiddos, which to me, when it comes in, kind of looks like scared. Maybe scared of losing something or somebody again. And, again, younger than 6 and sometimes even a little older, you can't identify any of that. You can't put words to that. But the way they come in to play, it's so apparent. I've had a little kid that I knew he was in foster care and he was moving to a future adoption home. And he came in and he lined up all these army men, took forever. And I'm like, okay, this is super fun. Lined up all these army men, took forever. And then he went and got this truck and rammed them through all of them. And I was like, okay. And so you could tell he was nervous when he came in, anxious when he came in. And then he was like, chill. And I didn't have to say anything. It was all through the play. And
Well, what do you think that was about?
Well,
Or does
I mean,
it even matter?
In my brain, it doesn't matter because they look and they feel better when
Yeah,
they're done.
yeah.
But it makes sense because I know the backstory
Yeah.
of he's anxious about moving again. This wasn't his first, and is it really going to stick?
Yeah.
You're hopeful.
You've got all these things lined up. I call them all my ducks in a row.
Yes.
And then here is the rug is about to get pulled right out from under you. Bam.
And it really could be anything. It could be goodbye to my old home. I mean, I don't know. But yeah.
Wow.
It's just how you see it in action.
Yeah.
And all I do is say, you are getting those all straight in a row and spending your time focusing on that. There's no judgment. There's no, hey, should you put another row? I don't want them to try to do things that they think I want them to do. And so it's so centered on them and they're leading it. And I'm just tracking with them. Wow, that truck took care of all those soldiers.
And how old was this little guy?
Let me think. He was probably 6 or 7.
Interesting. And so what you're saying is play, and I've heard this, but it's still one of those things that you're like,
Right.
that easy?
They're just playing.
Seriously?
Yeah.
But you know what I think, Stephanie? We don't give our kids enough time to play.
They're signed up for so much stuff and they're going and coming and it's
so
super busy.
Play is how they process things. A lot.
Huge. Yes, if they have time at home for you to just kind of watch the way they play, sometimes you'll see a lot of aggression. Sometimes you'll just see calmness. And it kind of will, for sure, with these kiddos, vary day by day. Some days I'm calm and playing with the baby dolls, and some days I've got the gun and we're hunting,
Yeah.
But yeah, it's just their language.
Yeah. That's fascinating about that. I know. I mean, if you start to become a detective
Yes.
Start to become a detective.
You mean like asking the questions and figure stuff out with kids?
Well, like, yeah, I mean, but like I would have never thought that the whole lining up, I'm thinking of myself. I'm thinking of myself as a child and the need to have everything in a line like those army men. You know what I'm saying? Like, wow, I want all these things in a line, and then the action of just just undoing all your efforts.
That can be satisfying too,
Yeah.
to my brain.
Yeah, I guess
They're
so.
all neat and in a row, and then, I got to destroy. Just like setting up those dominoes.
Yeah.
Then you knock
yeah,
them
that's
all
a
over.
whole, you can do like a whole, you can watch, I went to someone's house and their grandchild was watching YouTubes.
Yeah.
There's like,
Well, and when
somebody's making money on that one.
yeah, let's set up some dominoes. But when you said detective, I went to an actual play therapy session that I was having that was not going well.
Okay.
And I had to step back and figure out. I wanted to find out what might have happened to this kid, so I was asking questions.
Yeah.
4 years old. So I'm like asking questions and mommy this and daddy this, and they were just like all over the place, seeming very distracted and very anxious. And finally, for the next session, I just said, you know what, Miss Stephanie's not going to ask any questions today. This is your time. You just get to play. And you could just tell. I was like,
Yeah.
I was
Did
like
you
thinking.
get some clarity for yourself once you did that?
Whenever she started working in the play, and then she's making phone calls on the plastic phone, and I did eventually get my answers just through her play. And there's some direction, especially if I do have to go to court a lot of times. And so if I need to be able to answer something one way or the other, there's a way to, but first you just have to establish that, you know what, this is a place I can trust,
Yeah. Yeah. So what's an average, obviously every child processes things differently, but what's an average time for say I'll just 9-year-old little one that's had, some complex trauma. Maybe you don't know a specific thing, but just they've come into your home.
Right.
And what would you see as the average time for
sessions?
that you give the all clear?
Yeah, all clear.
All clear. Well, I'm 50 and I'm still not all
Yeah,
clear.
I was like, did we give the all clear? Like I said, the kids process so much faster. Depending on the kid, but it typically needs about 3 visits just to feel.
3 visits?
No.
Oh.
Just for them to feel calm.
Okay.
And this is a safe place. I can trust Miss Stephanie. I can tell her whatever, and she's not going to go, oh my gosh, I can't help you.
Yeah.
And then once we start, it depends. 6 weeks to 6 months. It just kind of.
Yeah. A year would be a good time.
depends. Right, because
You
it's
could
just
commit to a year.
not. Yes, I mean, if you're a younger kiddo and in the EMDR therapy for a year, I don't know. That to me is
That's great.
yeah
You
pushing it.
go
for, like,
once a week or what? How does that work?
If I recommend once we start processing, they're there once a week at least, and that normally works out, so that it's not taking too long. It is, and I can
you
check
do more
on
than
them.
once a week?
Yes, you can do twice a week,
Okay.
and depends on the intensity, and you don't want to make it too intense. But then you can check on them in a couple of days and how do they seem. And
I recently read a book by Dr. Bruce Perry, and he was talking about that we people, and this would go for children too, can only process just a few seconds or maybe a minute of their trauma without the brain trying to move to the protection place. And I think that's interesting in play. That would really explain a lot about why play, because play is they are in control of it versus like,
Right.
I know I feel like I have, and I think if I'm pretty honest about things, but I feel like I've probably re-traumatized my child in trying to get her to talk about things.
sure.
When you've said that a couple times, and I'm going, and I'm, I'm not a therapist, and I don't know what I'm doing a lot of the times.
You're a loving mom.
But, just trying, like, knowing that this is what's causing her issue and trying to get her to see it, like, that's too painful. And
Right.
and just stepping back and going, okay, we had a glimpse. You know,
Right.
I remember after a visitation one time, her staring out the window and me looking in the rearview mirror, and she was just staring out the window. And I just was able to say, it's okay to feel sad, you know, and like, that's all I needed to do. But then there's been these other moments where I'm like, you know, I know you're hurting about this, and I know you're in just like, blah, 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 and too much, like a hammer versus like, I don't know, what's the other tool that just...
A feather.
Maybe I just need safety goggles.
Yes, exactly.
I just wear some safety goggles and let this unfold.
Yes, right. And, it, you know, like with the Emdr, I keep those measuring spoons, like when you're cooking, so that the tablespoon all the way down to the 1/8, so that I can just, you know, I'll pick up some rice and go, how much are we willing to feel or look at or think about today? This much? No, less than that. Or we'll section off what has been deemed the bad feeling in the rice tray. Okay, we're going to just section that off over here in the rice tray, and he has to stay right there. Cannot get out. And let's come over and do some light, you know. You can tell it's a little too much.
Yeah. This is good, Stephanie.
And you can, like you're saying, just, you know, doing that at home.
Well, you know, we go to therapy for 45 minutes twice a week if we're very, very blessed or whatever. And then you're home for hours and hours and hours a day. And
you're in the trenches.
We need some training as parents. Like, you know what I'm saying? I'm not saying I want to be your therapist, but in a way I have, you know, it's kind of who I am in the sense, not a therapist, but I'm. Right. And so just knowing how to do this, how to process what's my role.
And what's crucial is that the parents are in a healthy emotional state. Healthy meaning if you've got your own trauma or you've got a really stressful job, or, you know, how can we make that environment as stress-free and calm as possible? And that's the other part of some of these kiddos that come into our lives. They probably came from a very chaos was their norm. And so coming to peace makes them so uncomfortable because they're not used to this, too quiet in here, you know? So we have to keep that in mind, you know.
What do we do about that? Obviously, we don't create chaos.
Just start blaring the music. No, no, it's about they're going to react
just being
to
aware.
the piece. And so you're normalizing, yes, this probably is uncomfortable for you, or you look angry about, maybe you get 30 seconds of banging on a pot, you know, I don't know.
And then we talked about sensory issues recently, and that was, you know, some kids really do need that, or they don't need it, but that's part of, that's a sensory issue maybe, that the needing the loud or being drunk. I don't remember how she described it, but kind of like that. Right. Go see the occupational therapist on that one.
Exactly.
Wow. Okay. So let's end on this note. Okay. Let's end on, and we didn't talk about a whole lot of behaviors, but I think what we talked about is it's all the same, really. I mean, the behavior itself is different, but what you've told us is there's something beneath it. What have you told us?
There's a disturbance.
Yeah.
There's a disturbance inside their body and their heart. And it wants to come out, and really it needs to come out. And we don't always have to necessarily identify it and what caused it, which we want to do.
Yes, we do.
But letting it, giving its time, giving it its exposure when it wants it in an appropriate way. And, you know, how you say what's appropriate. Like you're sitting next to her in the room, you're like, oh, the wall's not for banging. I love you. You don't love me. I do love you. And it's kind of repeating, you know, if they're like, but you never let me have the purple cup. I know. you're not arguing with them. Yes, I do. On Tuesday you had it, stop.
Yeah.
You're just in, I know. I know. I love you. And that, and they're going to wear out. Sometimes they'll fall asleep.
Yeah. That's so good. Yeah. Just letting the feelings rise up. And if you're a person like me, that just wasn't the way it was done in my home.
Right.
Those feelings were not, my parents were extremely uncomfortable with all of those feelings. And then I learned to shut them down, and I learned to stuff them, and I learned to let them come out in unhealthy ways.
Right. And this doesn't mean you get to be at the grocery store and let them express it on aisle 3.
Yeah.
This is what is appropriate. And okay, then we got to go pick them up, put them in the car, and either they figure it out and come in the car, or you got to go home.
I think I've left a whole cart of groceries before.
Sure. That's absolutely. So I don't want people, thinking, well, so my kid just gets to run amok in the house screaming their head off,
No.
What's appropriate, not hurting themselves or others. And let's start shortening the amount of time. Wow, that was only 5 minutes. Good job. And look at you. You're smiling. We're hugging. I don't know.
Yeah. And getting, one of my daughters tore a Kleenex to shreds the other day. And I'm like, wow, that was a great way to express your anger.
I'm okay with that.
I'm totally okay with that.
Yeah.
Here's a whole box. Like go at it,
Go crazy.
And then when you're calmed down, we'll clean them up. I'll help you,
Right.
Or whatever.
Right.
But where I want to end is something you said, and that is the caregiver. Mom as well is really all about.
Yeah.
It's really all about the caregiver. That's why I called it Mom as well.
Right.
It's like there was several different thoughts, but Mom as well, when Mom's well, all's well, right? But then there's also this learning, children that have come from hard places, as Karen Purvis said, it's learning how to help them well, learning to do it well in a way, to do something well. But then the biggest piece for me is creating this deep well of wisdom, if you will, that really a lot of it has come from my own healing and my own trauma. Sure. And as my dear Hungarian Holocaust survivor, she doesn't know me at all, but I just adore her, Dr. Edith Egger says she created a new relationship with her own trauma. And she's a therapist. She was a therapist. She's retired now, but that she can draw upon a well. Sure. That she draws upon. And so that really is powerful for me. And it's come from doing my own healing work.
Right.
And I really, if I had a vision for the future of mental health, and especially from children who've experienced developmental trauma, is that it would be this wraparound thing where you have, multiple therapists. Sure. One's working with mom and dad and maybe even siblings, and one's working with the child, and they're in your home, and they're helping you show and teaching you and helping you recognize your parts in this. And then there's the occupational therapist who all communicates with, and we're just wouldn't that just be so beautiful?
Absolutely. And then the parent doesn't feel like it's all on them, and
and they're supporting. And then you have the community that's coming around, especially in the first, I told you 7 years.
Yes.
But in the first few years, not first few months of you getting a placement, but you have people that are showing up for you saying, let me help.
That's good.
Let me help you. I mean, wouldn't that be just amazing?
Absolutely. I mean, I bring parents in and, help them, of course, and do family therapy. You're exactly right. Everybody getting their help from their well.
Yeah, because if you're struggling as a parent, like I have been, it doesn't mean that you're doing it wrong, or you're not enough, or we really aren't enough ourselves.
Just being aware that you're struggling and going, okay, so I'm going to do something about it. I'm going to get assistance or help.
Yeah, and being not afraid to ask. So thank you for sharing with us. Thank you for joining me today.
You're welcome.
Maybe you'll come back sometime.
Thank you for having me.
You're very welcome. Thank you guys for tuning in. I hope that this was helpful for you. I hope that you always take away from our time together just knowing that you're not alone, and it's okay to feel angry. It's okay to be frustrated. It's okay to experience regret. Mm-hmm. I mean, if you haven't experienced regret in a moment of time that you've been doing this, like, call me and tell me how, because I don't know. It is a hard job, and it's an important job. And so getting help, asking for help, expressing that you need help is the first thing, like saying it to your spouse or your best friend or somebody, because we all need it. We need it desperately. And so I want you to feel safe and to feel affirmed that you can reach out and ask for help. And EMDR is a phenomenal tool. It's helped me so much. And I described this to Stephanie, and she validated it. But it's kind of like you're processing these traumas, and you have this bunch of necklaces. If your jewelry box looks anything like mine, I hang them now, but I used to have a jewelry box, and it was just these necklaces are all just tangled up. And EMDR for me has been like taking one necklace and just taking one necklace sometimes out of this tangled web. It starts to loosen the others. Mm-hmm. And so it's like this just untangling of things. And starting with our children early on. I mean, I didn't start this process for 3 years ago with EMDR, and it's been powerful. So I just want to encourage you, invest, even if we can't find therapists that take our Medicaid, or there's a lot of different modalities. There's brain spotting, and there's all kinds of different things out there. But you might have to invest financially in something like this, but it's worth it. It's very powerful and highly recommend it. So anyway, give some thought to that. Take good care of yourself. Enjoy the cooler weather. Take a deep breath on the season that's coming in, and we'll see you next week. Mama's well. Yes, she is.